Hello and welcome to our presentation. My name is Alexander, and today with my colleague Aitek, we will present the research we have done to explore the applicability of reinforcement learning towards the treatment of HIV patients, along with our colleagues Vagelis and Vasilis. The concepts of this presentation are the following. Firstly, we will give an overview of the problem we are trying to tackle, strategies that have been used in the past to deal with it, and where reinforcement learning can be a good fit. A description of the Q-fitted algorithm used to generate the optimal medication strategies will be given, along with an overview of the equations that describe the evolution of the HIV virus in the human body and the equilibrium states connected to it. Moreover, to train the algorithm, a set of quality data that represents the real world as accurately as possible is needed. Therefore, a novel procedure used in that regard will be presented. Finally, a list of directions for future research will be given, after which the presentation will be concluded. Starting with HIV, what is HIV? HIV, or the human immunodeficiency virus, is a retrovirus that once it enters the human organism, it infects the healthy cells of the immune system and interrupts their regular behavior, which could lead to the deadly acquired immune deficiency syndrome, or AIDS. Nowadays, the treatment of this condition consists of a cocktail of drugs to suppress the development of the virus, but practice has shown that long-term exposure to this type of treatment of highly potent and costly medication is associated with adverse effects such as drug resistance and mutation of the virus. One of the most promising strategies to deal with this problem is the structured treatment interruption, or STI, in which patients during their treatment may change their medical diet and either receive only one approved drug or none of them. To schedule this strategy optimally, a smart algorithm is needed. And here is where the Q-fitted algorithm comes. This algorithm works by iteratively generating better and better approximations of the optimal medication strategy by solving a sequence of standard batch mode supervised learning problems with the Extra-3 algorithm, which is explained more thoroughly in the paper. This, of course, is done to satisfy a certain cost function that aims to minimize the amount of virus particles in the body, but also the cost of the treatment. Here it should be mentioned that these terms are also weighted, which means that their importance can be altered on a single patient basis. So, for example, for patients that experience severe effects to RTI drugs, the weight associated with them can be increased, and that means they can be penalized more. As for the dynamics of HIV, they have been successfully described by sixth-order state space representation. The states in this representation are firstly the number of healthy lymphocytes, the number of healthy macrophages, the number of infected lymphocytes, the number of infected macrophages, the number of free virus particles, and the number of HIV-specific cytotoxic cells. Now, what is more interesting than the equations themselves is that standard analysis can be performed on these equations to obtain some sort of information about key properties of the dynamics of the system, namely the equilibrium points. The HIV dynamics are represented by 3 equilibrium points: the non-infected, the infected but relatively healthy point, which is the target for any drug strategy, and the infected non-healthy point. The healthy point has a small basin of attraction, far smaller than the non-infected, and therefore any minor perturbation will drive the state into a non-healthy point. Therefore, the goal is to obtain aerial control strategies to drive the states from the non-healthy point to the healthy one. Now my colleague Aitek will take the word and present to you the rest of the presentation.
Thank you, Alex. Now I will continue with the data generation. And to train the algorithm, quality data that accurately represents the real world phenomenon is needed. And one way to go about this is to gather the data from real patients, but that process can be very time consuming and expensive since potentially millions of patients have to be followed. A more efficient method, however, is to generate the data numerically using the evolutional equations explained earlier. Moreover, by using the Q-fitted algorithm and applying it during the process, the generated data can be made more realistic. And this is because in reality, clinicians already have some information on which strategies are beneficial. And therefore, Applying schemes generated by the FIDIQ iterations algorithm generates data that is closer to the real world scenario. And of course, this makes it a lot more useful for reinforcement learning. And next up, we have some alternative methods. That is, some methods in which that could be used to improve this reinforcement learning for HIV treatment further. An alternative that is considered and is actively researched upon is online reinforcement learning, where there's no initial data, the model isn't initialized with any data, and the model learns as it collects data. The advantage of this is that it has a very dynamic approach as opposed to the offline reinforcement learning that has been implemented currently, and it's more dynamic to changes and perturbations, and it can respond better. But the disadvantage is that initially, because there is no data that was used to train the algorithm, some initial actions are taken at random, and this puts the model at risk of being stuck at early solutions, as well as making some critical early decision mistakes, which can be costly, especially in the case of HIV, which is quite a significant disease. And in the end, regarding this alternative method of online reinforcement learning, the trade-off between the exploration and exploitation is very critical, and this trade-off must be conducted very carefully before the online reinforcement learning method is implemented. And next up, we have some recommendations. First of all, as you mentioned, we need better data to account for variations in the dynamics. The variations could occur from a variety of reasons, just from the difference in patients and difference in other dynamic parameters. And also, transition from simulations to real life patients is also something that is very critical and is sort of underlooked so far. The observability is a significant matter. So far, the models just assume full observability of the states. However, that is not expected to be the case in real life. And furthermore, the exact statement, exact definition of the problem might change the more we learn about the real life situation. And another recommendation that could be said in line with the previous alternative method is that online and offline reinforcement learnings could be combined, which is initializing the model with offline data using still a significant amount of offline prior data to initialize the model with, and then using online learning for fine-tuning the policies to make it even better. To wrap up, in this presentation, we have described the few-fitted algorithm, which is the mathematical background and the basis in which we use to use reinforcement learning for the treatment of HIV. And then we explain the dynamics of HIV and how HIV could be modeled and how this is critical for the treatment. Next up, we took upon the equilibrium points of HIV, the key states, the three critical conditions which must be controlled and form the basis of our control problem. And then we explained the situation with the data generation, how resembling real world data is a critical problem and one of the main focuses of the research at this point. And we touched upon the alternative methods on how this reinforcement learning for HIV treatment could be further improved. In conclusion, with the use of reinforcement learning for HIV treatment, basically numerically simulates patient trajectories and from which optimal STI strategy could be produced using the clinical data. And it must be mentioned that there is still a significant room for improvement because there are differences between patients, there are mutations in the virus, and there are significant problems regarding the availability of data. These are the three main topics that must be addressed and further improved upon for further research. And thank you for listening to our presentation. Thank you for your time and attention, and feel free to ask us if you have any questions.